we're proving that there's variability in how people respond to hormones. And why is that? And obviously, it's a very complex interplay. And what we believe at Dama is that actually it's your medical history, it's how you metabolize, it's probably your race, your ethnicity, your microbiome may affect it, your genetics. So it's like a very complex ecosystem. We just don't have enough data and research. But our vision at Dama is to actually pave the way to actually understand this variability and use the information to predict if you're going to respond well or unwell to a specific hormone.
Welcome to the Femme Health Founder Series, the show about the innovations and leaders changing the face of women's health. From pioneering entrepreneurs and trailblazing investors to advocates breaking new ground in health and wellness, our guests are driving meaningful change across women's health. My name is Marianne, impact investor and editor of Notes to Self, the newsletter exploring investment opportunities within the theme of women's health. Join me and our guests as we dive into the stories, the science, and the strategies making a difference in women's lives. Great. So welcome to today's episode of Femme Health Founder Series, where we spotlight trailblazers shaping the future of women's health. Hormones rule our lives from puberty to menopause. They influence everything from our mood to our health. And today we're diving into the fascinating world of hormones with none other than Paulina Zetsula, co-founder of Dama Health, and an inspiring entrepreneur and physician who's revolutionizing the way we think about personalized hormone therapy. Paulina, it's great to have you on the show.
Thank you so much for having me, and huge kudos for pronouncing my surname so well. Very impressive.
Did I get that right?
That was really good. It's Polish, so a lot of people struggle with that. So yeah, thank you so much for inviting me and doing this show. I think it's super important work.
Absolutely. It's a great pleasure. We talked earlier before we actually started recording, and we talked about side effects. And I shared my own story about contraceptives and the fact that I noticed that I had side effects and I had to change some things. But I'm fascinated about the work that you're doing because it's all about hormones. So I think to start, maybe let's set the scene. Tell us a little bit about your background. Who is Paulina and how did you get here?
Of course. Wow, who's Paulina? It's such a deep question. But the story is that I applied to med school at Imperial College London from Poland with the big vision of working in global health. That's what I always wanted to do. I wanted to take medicine and work globally for in places that need this the most. So I've always been kind of thinking about the broader impact that I could have if I was going down the medical route. But I very quickly realized that medicine is a lot today about disease, and very reactive health system in terms of emergency and oncology, cardiovascular disease. It's and a huge focus on that when you're studying medicine and when you're becoming a doctor. But I was always so passionate about the preventative and making people healthier. So I didn't quite fit. It wasn't quite right for me in terms of I just felt like a bit of it just doesn't feel right. So then I started getting involved in the world of innovation and health tech. Because at med school, I realized incredible companies were starting to open up in the US and in London, really bringing innovation to healthcare. And that made me realize, oh, wow, this could have a huge impact in medicine and that's going to change medicine. And the women's health was just always there. I was it was just the topic that I've always been passionate about of it's either going to be neonatal, so working with babies or with mothers. That's what I always wanted to do because I always felt it's also such a neglected area of medicine because it's all about the new life versus treating disease. So always been focusing on women's health. So then I was just working with different health tech startups, learning about the innovation world. I went to business school when I met my co-founder, to gain a bit of skills and just break from the medical world. But I also obviously was continuing with my medical degree and everything. And I took part in primary care shadowing, as we all did. And contraception visits just really caught my attention because a lot of the other stuff, it's people feel very comfortable with in terms of physicians, treating diabetes. There's very clear guidelines, exactly what to do. There's so much research, but contraception, it was just something that felt so off. The doctors didn't really know how to counsel the patients in the 10 minutes or what to tell them. The patients felt a bit uncomfortable, how can you make that decision a 10-minute visit? Because it's not just something that you will follow your doctor to exactly what you do, because it's your decision at the end of the day, right? Which contraception you'd want to take. So I started thinking about this of there's around like 200 different brands, more than 10 different methods. It's not just a pill, right? There's like patches and rings, there's natural family planning, there's so many different methods. And first of all, we don't really know about our options, but no one really knows like what's best for me. And the doctors didn't know as well. So that was my first kind of interaction with this. And I obviously then reflected on my own experience of like, I've tried a pill that was okay for me when I was younger. I think as many of us, I was prescribed something for acne and I was actually okay on it. But then when I tried this later, like I reacted very differently and I actually had side effects. So it just got me thinking of actually, the metabolism, the whole system is very complicated and it's not that like something that you've tried in the past is not always going to work for you. And I always think about it as well when women go on contraception after pregnancy, your body may react very, very differently to something that you were okay with in the past. So just started thinking about this all. And when I met my co-founder, we were actually introduced. I realized she was actually like studying the same problem. So all her friends were suffering different side effects. And she's a scientist by background. So she actually wanted to do a PhD in this topic of, how can we react to contraception so differently? Can I study this? And that's how we met our medical academic co-founder who is at Yale. He's running a lab and studying pharmacogenetics of contraception. And he's probably the only researcher at the time that was showing that women react so differently to implants. So he had a study where women were, the implant is meant to be releasing the same amount of hormone for everyone. Like he actually measured the hormones for women and noticed that because of the pharmacodynamics and kinetics, like everyone had a different level of the hormone. And he was just fascinated. Actually, that means that for some women, they have not enough. So they might actually be at risk of pregnancy versus some women have too much and they are actually at risk of side effects. So it was just the first glimpse of like the proof, right? That like, because we've all been talking about this, that we've felt these side effects and no one really believed us, right? I think there was a phase and I think now we're like past it. I think it's now, we have the research, we have the data, a lot of women spoke up. But I think we had a phase in history recently where the side effects were not really taken seriously. So he was actually proving, like we have different levels, we metabolize it differently, there's a huge variability. And then he started studying the why. Okay, we're proving that there's variability in how people respond to hormones. And why is that? And obviously it's a very complex interplay. And what we believe at Dama is that actually it's your medical history, it's how you metabolize, it's probably your race, your ethnicity, your microbiome may affect it, your genetics. So it's like a very complex ecosystem. We just don't have enough data and research. But our vision at Dama is to actually pave the way to actually understand this variability and use the information to predict if you're going to respond well or unwell to a specific hormone and actually make personalized prescriptions going forward.
Just thinking about that sort of trial and error, what is it that makes you so passionate about this particular topic, about what you're working on?
Yes, absolutely. So I just very much think that the whole future of medicine will be very personalized and precise. And it's exciting that some of this is already happening in like oncology, immunology. Some of it is cardiovascular as well. You can really see huge advancements that we made. And I just wish we could do the same in women's health. And hormones is such a specific topic because we take them, when you think about it, like we start very often as teenagers for various reasons, right?
Yes.
Is it acne? And then you think about contraception. And then some women will use it for PCOS, endometriosis, if they have difficult periods. And then you go through your pregnancies. And then you end up with the perimenopause and menopause stage of life as well, which again, you have to start picking up the hormone topic. So it's like always there. And I feel like it's so important for the quality of life for women. And it's not like an acute condition, right? That you might get, appendicitis or something like that, and you get to the hospital and fix it. It's figuring out your hormones is just so important because it's a lifelong thing that you have to figure out for yourself. And it's something that we kind of often are left alone in the sense of like, we have to decide, like you can now order online which contraceptive you want as well, or you can go to your doctor and tell them, I want this method or that method. HRT, I think it's been also a huge topic because for a long time it wasn't even accessible. A lot of people were like scared to prescribe it. So I think it's just really important to study this and understand this better because we are taking it like day in and out. And it's something that like, basically the whole life we have to figure out whether we want to take hormones or not, whether we have the risk. So yeah, it's just, I think, very important, obviously, very passionate about this, but it's kind of working towards that future of precision and personalized medicine generally. And I think women's health should also move towards that as well.
Yeah, no, I completely share your thoughts and your view about the future of women's health being personalized and precision medicine. And I think if we think about it, when we think about also menopause, which is very much hormone related, there's so many women, I forget the statistics now, that are going to be going into menopause, just given the demographics across the globe. So we're talking about a huge market here, across the lifetime from, say, puberty up until, menopause and beyond. It's all about hormones.
Absolutely, absolutely. And I'm really glad to see actually there is definitely more awareness and education and people taking things into their own hands, right, and deciding. I think we just need the science and the data and the innovation to catch up as well. And for that, we obviously need the funding. So it's there's definitely a
Yes.
movement. It's just picking up.
Yeah. And talking about the funding, I think I'm very keen to ask you what have been some of the biggest challenges that you've faced as a founder in this space.
Yeah, absolutely. So I think health tech is generally a very difficult space in terms of reimbursement challenges. For example, you create a new innovation and it's really hard to know whether you're actually going to get reimbursed for it. The pace of innovation is also very different because you have to think about clinical trials, you have to think about adoption, and in a very regulated
Yes.
market, that obviously you have to think about clinical safety and data safety. So health tech is generally very difficult. And it's also that we haven't seen huge winners in the space. Obviously, there's a few companies that the timing was amazing and they raised a lot of money, but it's not that we've really proven that specific business model really works in a health tech. And I think as you're seeing between different countries, the health systems as well, we're kind of struggling with healthcare in general right now. So I think health tech is just difficult. And whether you're in mental health or women's health or any other area, I think health tech comes with its own challenges. But I think women's health, like, it is even harder because generally there's less funding that has gone, like, historically as well to the research in science. So, for example, when we initially started this, I was like, okay, let's go to the data, like biobanks and data banks, to see have we had data on women and hormone responses. If we had, then we can, work with some data scientists and actually create those models and actually personalize straight away. So you would do that when you were like in, for example, radiology startup. You would, work with a hospital. They have like 10 and 10 of data on different scans. So they would just basically use that data to create innovation. However, we just couldn't do that in women's health. Like, no one had the data on what we needed. So we were like, okay, well, great. This is potentially an opportunity for us to step in and like create that data set. However, it just takes so much more time. And then that means you need really patient investors, right? So it's just all of it like extra difficult because you don't have the IP and the research and the science to be just like, okay, let's just commercialize this straight away. So we've been also having to accelerate the research and work with researchers, which is like super important work and it's very rewarding, but it's just so much slower and so much more behind than other areas that it's just extra level of difficulty, I think, in women's health. And as I mentioned previously, for a while we've been struggling with, even as women generally, like to say that the side effects are real, right? So like we've just gotten over the first, like they're validated. So it's just like extra difficult. However, I've been actually
Talk about being gaslighted.
yeah,
Talk about being.
exactly. So this it's just extra difficult. However, to be honest, I must say our investors have been really good, at least the ones that we've been working with, obviously. But a lot of them, even if they're male, they would be like, my wife, my sister, my daughter, like they tell me about this. So they can also relate to it. And it's, I think there's definitely a bit more understanding now and awareness of the effects of hormone therapy and contraception in women.
Yes. And I think we touched on this earlier just before we came on the call. But I think also with in the US, I think coming into the elections, we saw that both parties or both candidates, healthcare was a topic. And of course, looking at the policies, I mean, they had both different ways of trying to tackle healthcare. But I think what was interesting was healthcare was definitely a topic for both candidates. And I think now with President-elect Trump, just looking at the policies, of course, things still need to be worked out, details still need to be shared. But just based on the policies, of the president-elect Trump, I think what we're going to see is a bit more deregulation in the space, which means that potentially there will be less government funding for some areas, which really means that we're going to need private investors to come in and pick up on some of the topics in healthcare to move that forward. But I think let's see what happens in terms of what policies actually, the details, what the details are. But I think healthcare is an exciting time to be in for an investor, particularly if we think around the world, different governments are all struggling with healthcare costs. It's the same thing in Switzerland. Healthcare costs are rising on an annual basis. So I think it's in the interest, of for all of us, globally, private investors, private-public partnerships come together and accelerate on some of the pressing topics of which women's health is
Absolutely, one. Absolutely. I think you raise a really interesting point with the less governmental money going to fund to sexual and reproductive health in the US. That's something that we are predicting that could happen. And at the beginning, we were slightly worried, obviously, as a startup operating in the space. However, some of our private investors, they were saying, this is an incredible opportunity for as you said, the private market to step up. Because if the government is not providing these services, the demand is not going to go anywhere. The demand is going to be even higher, right? Because you can't get your needs met with the current system. And to be honest, the demand is definitely going higher because women are more aware. They demand more because we have now understand that actually the provider that was just giving us the first contraceptive method, not really thinking about different options, like probably don't want to go there anymore. I want to find some other solution. And there's so many other solutions now, right? With the telehealth, and the private market can definitely step up a lot, I think. And that's the opportunity for companies like ours, where actually there's already women asking, right? We actually don't have a direct consumer offering today, but that's what we're thinking about in the future. Like, is that something that we need to do because of the political and the market demands as well, of just, the current system not able to meet the needs of people that they currently have.
Absolutely. And I think that brings me to my next point, which is about, other entrepreneurs. I think women's health, there has been such a gap. I think McKinsey mentioned or stated that it's a $1 trillion gap. So we need more of us in this space, more of you, Paulina, working on all of the different gaps that we have in this space. So I think, given your experience so far on your entrepreneurial journey, can you share any advice for other entrepreneurs that are interested in starting a venture in women's health?
Absolutely.
What do you wish you'd known when you started?
I wish I knew that everything's going to be longer and more difficult than you think, and it costs more than you think as well. So a lot of patience and resilience is the way to go. And that is just not that glamorous as it looks on LinkedIn, that it's just very, very hard work. And as we discussed, health tech in general, like, difficult area because you have to deal with so many challenges, but just women's health, as mentioned, like, it's not as glamorous, right? So it's not just like a fun impact project, but it's actually just a lot of hard work figuring out, like, how does it fit in the system. So I think that's the main thing, is like really thinking hard, how does it fit in the system, and which system, like which business model. For example, here in the UK, we actually decided that it's not the best place for us because the biggest market here is the NHS, and we decided that probably based on the research, obviously, that we've done, there's no way that precision medicine and personalization in women's health is going to be currently the top of the agenda because of the other pressing needs that the system has with, aging population, the waiting times. It's just the health system is really struggling. So then we decided, okay, US is probably a better market. So it's kind of like really navigating and making those really strict decisions, even though that the need is everywhere, right? Like, because you have to fit into the system and really think through, like, where the reimbursement is going to be, like, who's going to be the payer at the end of the day. So we spend a lot of time, like, with advisors and thinking through this to really think about the short term versus long term, like, what is our go-to market, because we need to advance the data, the research, and what is really the long term, like, who's actually going to be benefiting over the long term. Is it the pharma? Is it the insurance? So really thinking that through. As I've seen a lot of startups being able to raise a lot and deliver in the short term in the startup in the health tech, but then it just flops the moment the VC funding runs out. So you kind of have to be like sustainably building for like that future vision. And obviously, just more on the softer side, as I mentioned, it's a long journey and it's a hard one. So investors, mentors, and community are everything. Like, we have incredibly supportive investors who we can honestly talk to. We have mentors who been there, done that, and so many learnings I got are from startups that are just, 1 or 2 steps ahead. So you can really fast forward and accelerate everything because you have the community. And I think health the community is great. So it's challenging, in terms of the business building, but actually incredible community, because at the end of the day, we're all doing this for with such for the impact for us, it's women's health, and whether you're a mental health startup, it's all going to be about mental health. So I think it attracts really internally motivated and impact driven people. So at the end of the day, the community is really great. People share, people help each other. So that's a really nice thing about joining this ecosystem and really making the most out of it.
Yeah, I love what you've said about the community, and indeed, that's also what I've noticed. I think everyone that I've spoken to, whether it's a founder or advocates or investors who are passionate about women's health, it's really the passion that is the big driver. It's really that impact, and so I think we are in it for the long haul because we're impact first or impact driven. So it's a very important point you make about that.
Absolutely. And obviously it's business, right? And at the end of the day, we also need to create value for our investors and for the market. However, it's important I think the impact driven helps you just keep going, and the resilience and the long-term strategy can pay off, so that sort of passion and impact can help with that. Because you just need to keep finding it, and in the initial stages as well, there's a lot of pivoting and changing and being agile. So that kind of the impact for the long-term vision really helps to go through that.
Yeah, but you've been on this journey for a couple of years now. We took together with your co-founder, working really hard. There's so much graft that has gone on behind the scenes. Can you share one of your recent achievements? I know of your milestones, and I'm so proud and so happy for you. I think it's super awesome, but I'd love to share that with everyone listening.
Thank you. I appreciate very often I feel nothing is, I feel it's very slow, or we're not going fast enough. But when you take a step back, you actually realize things are going. It's just, you just, with the limited resources, you have to just be very, very mindful of what you're paying attention to. So the biggest milestone recently is that we got awarded an ARPA-H grant, which is very exciting because we are part of a consortium. And the consortium is super innovative and visionary. And I'm really excited to be part of this because we got together with 2 companies. One is doing a novel diagnostic for endometriosis, which is so important and so needed. And this is an example where you just need to so much money needs to be invested in this, because it's ridiculous that we don't have a non-invasive diagnostic for endometriosis. But it's just started moving recently, which is exciting. So we partner with them and a company that is measuring symptoms really effectively of endometriosis as well. And basically altogether we are pitching this future of endometriosis with better diagnosis, better symptom tracking, and personalized treatment. So we will be able to do future extra research on what we've been always doing with the genetics, but specifically for endometriosis patients, which is, I'm really, really happy about this, because obviously for a lot of women, contraception is super important for different reasons. But patients with endometriosis, currently contraception is the first line to manage your symptoms. And I think the future obviously will have better and more curative treatments for endometriosis as well. But as of today, the first thing that your physician is probably going to suggest to you is to try contraception. And again, the trial and error starts, which one, which formulation. And it's frustrating for everyone, because on average, women try to 3 to 4 different types. And it's a long journey, and it's really frustrating, and you're suffering from these side effects in the meantime. But for endometriosis patients, not only you're suffering from the side effects, but your endometriosis is getting worse. So I'm just super passionate about this, because I think our work is going to really impact positively those patients who suffer from difficult periods, PCOS, endometriosis. I think that's where the impact is really, really high, because you're not only helping them live with less suffering as of today, but it's actually going to impact their fertility outcomes, their health outcomes over time. So yeah, I'm just really, really passionate about this project. And it's great because we will be able to get another research study going on with genetics to validate our previous funding and research. So which is really, really exciting. And also just great to see ARPA-H putting so much money into women's health. So all their projects that were funded were also super innovative. So things like ovarian aging, longevity, like they really funded fascinating, like future thinking projects. So it's really, really great to be part of this.
Yeah. No, it's fantastic. I mean, getting that $3 million award was really fantastic, but I think it also speaks to the potential within the space. I think if we look at endometriosis as a case in point, it takes on average between 7 to 10 years before a woman is properly diagnosed. And that whole time you are suffering, it's painful. There's also gaslighting because your symptoms, at a point you actually stop reporting symptoms because you think no one's going to believe me anyway. So that it's really fascinating. I think the latest statistic I heard about endometriosis is that it affects people actually even more than cancer. So the people who are suffering from endometriosis is actually a lot more than cancer, and it's about a $200 billion market. So huge opportunity in that space.
And hugely also
financial
neglected. Absolutely.
Yes, absolutely. So I think as we come to the end of our conversation, we could go on, to speak more. But I just wanted to get your thoughts, Paulina. How can investors support you in this space? Because I think the work you're doing is not just driving real impact, but we're talking about market potential that is huge for financial opportunity as well. So how can investors support you?
Absolutely. I think, to be honest, we are all in this together in the sense of we want the future of healthcare to be different, right? We want the precision, personalization, and it seems to be like no one quite figured it out. We're like still struggling to find the business models, and I think we just need to do it collectively. Like investors who can connect the dots with us, like connect us to the different startups, to the industry. It's kind of like that common effort of like we have this vision for the future of healthcare and the future of women's health, and how do we get there? And I think it's just kind of taking those bold decisions in women's health as well. Like I was speaking to founder friends in women's health that we are all so limited in terms of resource and, asking for all the grant money to like slowly take it step by step. And I have a founder friend who is developing like continuous hormone monitoring for women, like incredible. That's going to completely change the game. But this is a difficult biotechnology device to develop. Like she needs a lot of funding. So it's just kind of like channeling and like allowing that innovation to happen, which obviously requires quite innovative investors as well to actually be joining us in the early stage. And as you said, like for the long run of being there with the impact. So definitely, and the community as well. And that's something that is super important of getting people together, talking about different things, the impact of the current, events like that, what's going to happen in women's health. So we're just kind of like helping each other out. There's so many different ways. But obviously, if anyone is interested, we always speak to investors, always keen to connect. And so thank you to you as well for doing this work.
No, thank you so much, Paulina. And really for all of our listeners, we will put the link to Paulina's details and Dama Health. So you can all see what Dama Health is working on. And if you'd like to be connected, then of course, please just reach out to me or to Paulina directly. I'm very happy to continue this conversation with our community. Paulina, it's been really, really great to have you. I think for me, two things I take away: we need patient capital in this space, and we need not just patient capital, we need smart capitals. It's not just about the money, but it's also about the connections. It's about the network, and it's about the community, as you said. So this is something that appeals to me and my community, and let's get the word out and keep pushing for the long haul for women's health.
Thank you so much. And
Thank you, Paulina. Thank you so much. It's great, really great to have you.
Thank you for having me.
That's a wrap for today's episode of the Femme Health Founder Series. I hope you found the conversation as inspiring and thought-provoking as I did. If you enjoyed this episode, then please subscribe, leave me a comment, and share it with someone who'd love to join the conversation. Don't forget to follow us for updates on upcoming episodes and more insights into the future of women's health. Thank you for listening. And until next time, stay curious, stay inspired, and keep championing the health of women everywhere.